Let's talk about boundaries in therapy. Boundaries in therapy are necessary to protect the therapist and the client, and they are also a means for the therapist to model healthy boundaries within a safe relationship to the client. There are many different ways that boundaries can show up in therapy. So, if we think of policies and procedures, this might be enforcing no show policies, enforcing a late cancellation or no show fee. If we're thinking about communication and boundaries around that, it may be boundaries with regard to texting or emailing between sessions, or when the therapist will check their email outside of office hours, or if they even do. There are also boundaries that are really guided by ethical guidelines and principles. So, for example, not having a relationship outside of the therapeutic relationship. Regardless of what the boundaries are, they all serve a purpose. On the side of the therapist, boundaries may protect their time, their finances, and obviously protect them from ethical violations. On the side of the client, boundaries are necessary to protect them from being taken advantage of, to protect them from becoming too dependent or attached on their therapist, to keep them safe, among other things. Then, when we think about boundaries from a modeling standpoint, when the therapist sets boundaries with the client, it models what boundaries look like in a healthy relationship. This can also teach the client themselves how to set boundaries and empower them to do so. Boundaries in general, but especially in the therapeutic relationship, are not mean. They're not supposed to be a punishment. They are simply there to protect the therapist, the client, and their relationship.